Welcome to Health Educator. Don't forget always to click on the subscribe button. Today is going to be about episiotomy. Episiotomy is an incision made between the vagina and the rectum in order to increase the size of the vagina and facilitate the delivery of baby. Episiotomy might be recommended if your baby need to be quickly delivered because your baby's shoulder is stuck behind your pelvic bone, your baby has an abnormal heart pattern during delivery, you need an operational vaginal delivery. There are two types of episiotomy incisions. One midline incision, it is an incision done vertically. A midline incision is easier to repair, but it has high risk of extending into the anal area. Two mediolateral incision, it is an incision done at an angle. A mediolateral incision offers the best protection from an extended fear affecting the anal area, but it is often more painful and is more difficult to repair. Advantages of episiotomy. Episiotomy can decrease the amount of pushing during delivery. It can also decrease trauma to the vaginal tissues and expedite delivery of the baby, when delivery must be accomplished fast and efficiently. Complication during episiotomy. Bleeding, infection, swelling, defects in wound closure, localized pain, and sexual dysfunction. How is episiotomy repaired? The repair is straightforward and is fairly simple to perform. The incision is repaired by suturing the wound together. Episiotomy risk. Episiotomy recovery is uncomfortable, and sometimes the surgical incision is more extensive than a natural tear would have been. Infection is also possible. For some women, an episiotomy causes pain during sex in the months after delivery. What is the healing time for episiotomy? The typical healing time for an episiotomy is around 4 to 6 weeks depending on the size of the incision and the type of suture material used to close the wound. So if you have any question, leave a comment. Thank you for watching this video. Don't forget to click on the subscribe button, to get more video from Health Educator.